Hi, folks. Welcome, 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 welcome. Thanks for joining us this evening. We're just going to give another minute to allow people to come on in before we get started. And then we'll do introductions and then we'll get started. Very happy that you're spending some time with us this evening in your busy and complicated and new, the new kind of world that we're living in. So hi, everybody. Welcome to the American Journal of Sexuality Education lecture series. My name is Bill Tavener, and I'm the chief editor of the journal. Thank you very much for joining us this evening. I'm pleased to introduce our guest speakers, Jen Rogers and Susan Gilbert. Jen Rogers has been responsible for developing and leading key family planning, women's health, and reproductive health projects and policy initiatives for the past 17 years. As co-director of the National Coalition for Sexual Health, or NCSH, Jen is charged with promoting high-quality sexual health information and health services, and with leading the NCSH Healthcare Action Group. She holds a Master's of Public Health from Boston University with an emphasis on reproductive health. Susan Gilbert, a consultant to Altarum, also serves as co-director of NCSH and manages its Communications Action Group. Previously, Susan served as a health communications consultant to Columbia University, Johns Hopkins University, Population Services International, Women Heart, and other NGOs. Susan holds a Master of Public Health Administration with an emphasis in public health from the University of Massachusetts at Amherst. Together with Molly Carmody, they are the co-authors of NCSH materials on COVID-19 and sexual health, which is the subject of tonight's lecture. If you give me another moment, I'm just going to allow a few more people who are waiting to come on in. Welcome, folks who are just joining us. We're about to get started. We're going to ask our speakers to take about 20 minutes or so for their lecture, and then we're going to open it up for Q&A and encourage people to come off mute to ask some questions when we're ready for Q&A. So welcome, Jen and Susan, and thank you for sharing your expertise with us this evening.
Thank you. Thanks so much, Bill. It's so great to see a couple of your faces. I recognize a few of you. Good evening for those of you on the East Coast, and good afternoon to those on the West Coast or Central Time. I want to welcome you to this webinar. We're really thrilled to be here and to talk to you more about COVID-19 and sexual health messaging. I'm going to share my slides with you right now, so bear with me for 1 second. Okay, here we go. Hopefully you can all see the slides. Our plan for tonight is to, first and foremost, give you a brief and short introduction to the National Coalition for Sexual Health, who we are and what we do. Then to talk more specifically about why we thought there was a need and what the purpose of this new COVID-19 and sexual health messaging document and fact sheets that we've created. Susan's gonna, my co-presenter here is gonna talk more about some of the specific messages and the topics and messages that we created around COVID-19 and sexual health. And then we're gonna end by talking about some of our next steps and where you can find our resources and materials. So first, what is the National Coalition for Sexual Health? We were established now about 8 years ago in 2012. We are funded by the Centers for Disease Control, and we're a thriving coalition of over 150 members working together to really improve the sexual health of Americans nationwide. As many of you probably know on this phone, on this call, in the past there's been some of the traditional approaches to sexual health have been a bit narrow in scope. Sometimes they dwell or often negative or are fear-based. And we've really came together as a group, as members, to embrace a positive, a holistic, a comprehensive approach to not only sexual health, but sexual health well-being and wellness. So what does it mean to be sexually well? Our aim is to really promote high quality sexual health information and health services. We do this by conducting national media outreach. So we have a big media presence by putting our members in the media, by developing practical tools and products. And I'm going to share some of those tools and products with you in just a bit. And then also encouraging both the public and healthcare providers to really take action. So what can you do to help improve sexual health? We do this work through two major working groups. The first is our Communications Action Group, or the CAG, and the other group is the Healthcare Action Group, or the HCAG. And what we do is we draw upon the evidence base. So what does the science tell us? What are we read peer-reviewed articles. We really try to rely on the science, as well as the collective expertise of our members. And we pre-test our materials. So making sure that they resonate with the public or with healthcare providers, making sure that they're accurate and accessible and practical, clear and concise and practical. And in turn, our members then employ their extensive networks to disseminate those materials, either to their network of healthcare providers or to their niche groups or the public. So our members include folks like you, healthcare providers, public health professionals, various consumer organizations, universities and academia, lots of communications professionals. I'll name just a few of our organizations that you might be familiar with. First, the American Journal of Sexuality Education, thanks Bill. Planned Parenthood, SECUS, Advocates for Youth, ASECT, again, to name a few. If you'd like to see our full membership list, it's on our website, and we'll share the website URL in just a bit. As I mentioned, here are some of our products. On the top right-hand corner is a guide called Take Charge of Your Sexual Health. This is a guide for the public about what it means to have good sexual health and to, what you need to know about preventive sexual health services. In the middle there, Sexual Health in Your Patients, a provider's guide. This again is for healthcare professionals about how to talk to your patients about sexual health, how to start that conversation, what does a good sexual history look like, and a table of all the preventive health services that we should be offering our patients. On our website, we also have a compendium of sexual and reproductive health services for healthcare providers that you can filter. And then lastly, I want to mention, we have a separate website called the 5 Action Steps to Good Sexual Health. So we thought it was really important to create specific, clear action steps that describe what it really means to have quote unquote good sexual health. And we provide practical resources and tips and tools. So I really encourage you to check out that website. Again, here's some more of our public materials. We try to make them eye-catching and engaging. We just released this year a sexual health quiz to be an interactive platform for people to take questions, to answer questions about their sexual health and wellness. And we have some sort of more fact-based questions, but we also ask a lot of questions about, what does it mean to be in a good relationship? What does it look like to argue fairly, so on and so forth. And then again, in the bottom here are just some of our fun graphics that you can share. Everything's available free online, and please feel free to take those and use those in your own social media campaigns as well. So, why this document? Why the need for a document on COVID-19 and sexual health? I think some of it's fairly obvious, but through our work with both the sexual health communications and with healthcare delivery, we really saw both an interest and a need to create clear fact sheets for the public and for healthcare professionals on this topic. What do we know? What don't we know? How do we make them clear and practical and accurate, especially during this time of uncertainty and confusion? I think it's really important to be as accurate and clear and nuanced as we can. And then also to have all those messages be in one central place or location. We thought it was really important to sort of bring it all together. We want to acknowledge all of the good work that are being done across the field on these different topics, but how do we bring this all together so people have a sort of a one-stop shop for messages around sexual health? So our staff began really pulling these resources together from a variety of sources and crafting these messages. And these messages were really to serve as a foundation for our communications with our membership, for our own social media campaigns, but also for others' social media campaigns to help guide communication specialists and healthcare professionals, and as well for the media. So when we reach out to the media about these topics, that we, again, can be clear and concise and accurate. So right now we've developed a couple of, more than a couple, several topics about sexual health and COVID-19. Those include messages about transmission, so general transmission. Also, what does it mean to have good sexual health during this time? We have messages around sexual partners and maintaining a good sex life. How do we keep a relationship strong? Access to good sexual health services. And then also, what does it mean to be in an abusive relationship right now while on lockdown? And these are certainly not all the topics we could cover. And currently, we're actually in the process of developing others, including, for instance, around more specific messaging around HIV testing and prevention, as well as infertility, pregnancy, prenatal and postnatal care, and also more messages around sexual assault, harassment, and abuse. At the end of this, we'd love to hear from you. So start thinking, what challenges are you facing, and what additional topics might be helpful for you as in your work. We really want to make sure that we are being responsive to the field. Before we move on to the specifics of those messages, I just want to talk a little bit about how we created these fact sheets so you can understand sort of the origin story here. They are based on the latest data and recommendations. We went to the source materials, to the journals, read those through and consulted with the CDC. They're also from existing resources that we pulled from leading public health and sexual health organizations, as well as input from our coalition's COVID-19 and sexual health working group. So we developed a working group that's comprised of almost 35 members from the two action groups that I mentioned earlier, the CAG and the HCAG. So experts from both the communications as well as the healthcare delivery fields coming together to say, what can we say about sexual health and COVID-19? And we promised our members, and we're promising you all in this public venue, that we're really committed to make sure that we keep these messages up to date. So as new science, as new guidelines become available, as we develop new content areas, we will be updating these fact sheets and posting them. And just a little story, we posted these fact sheets at first on a Thursday afternoon. And I was telling Bill earlier that by that afternoon, a new study had come out on semen and some evidence that COVID-19 might be found in semen. And so we had to pull down the fact sheet and update that and put it back up on Friday. So this is definitely a living document and a labor of love, but we are committed to making sure that this is up to date and responsive to everybody's needs. So with that, I'm going to turn it over to Susan, our communications expert and also the co-director of the coalition. She's going to really highlight some of the main messages in our fact sheets and tell you again where you can find some of these resources, including all of our COVID and sexual health materials. So Susan?
Oh, great. Thanks so much, Jen, and thanks, Bill. It's great to join all of you. As I said earlier, this is often the time where we might be Zooming with friends or family, so we really appreciate your time this evening. As Jen mentioned, we've developed messaging around 7 key topics. Clearly, we're not going to walk through all of those in detail tonight, but what I'd like to do is just really give you a flavor of the topics and also talk about some of the deliberate choices we made around content and language as we developed this messaging. So, and the other thing I want to say is that we've really tried to mirror the coalition's philosophy of a comprehensive, positive approach to sexual health and sexual health with COVID. So we talk about the physical dimensions, the emotional dimensions, the relationship dimensions. We aim to give people clear and practical advice. And we're also sex positive. We recognize that sexuality and relationships are key to many people. So we always want to keep that in mind. So let's go to the first slide or the next slide. So the first topic we address is how is COVID-19 spread? And we talk about both sexual and non-sexual routes of transmission. And I think before we get into specific sexual activities, we thought it was very important to emphasize the risk of close contact and intimacy overall. And this was something that came out of the working group, that people felt very strongly that we really needed to put this in the context of If you're close enough to touch an infected partner, you're close enough to get the virus. Just to bring this point home that it's not just about specific sexual activities, but it's also about close contact. And then we do try to provide some practical guidance around what that close contact means. And we talk about things like hugging and sitting together and being in bed together. The other thing that we thought was really important was to be specific about sexual activities versus using the word sex. And in some of the original guidance we saw, people were making statements just about sex. And I think for the general public, a lot of people interpret sex pretty narrowly, and they might think of that as only intercourse. So we felt to be clear and practical with the public, we really need to talk about specific sexual activities, such as kissing and rimming, that could be higher risk. Lastly, we think it's really important that we tell the truth and that we're clear about what we know and what we don't know. And again, just being careful to not make statements that COVID-19 is not this. So for example, in some communications I've seen in some media coverage, people are making statements like COVID-19 is not an STI, COVID-19 is not sexually transmitted. And again, I think that could lead to confusion, because if things like kissing and rimming are part of sexual activities and sexual interaction, then I don't think it helps us to say that this is not sexually transmitted and talk about it in that way. So let's go on to the next slide. So the next topic we tackle is partners. And, you know, a lot of the initial guidance we saw focused on partners who were living together. But the reality is, and we know from national surveys, that the majority of people, or at least over 50% of adults, don't live with a spouse or partner. And so we felt it was really important as a coalition to acknowledge this, that some people live together, some people live apart. We have different types of partnerships. We might have a long-term partner, a new partner, casual partners. And so what we've aimed to do in the messaging is provide advice for people in those different situations and recognize those different situations. You know, we do echo the advice around the fact that you are your safest sex partner. We also talk about what it means to be partnered with someone that you're living with at home. But we also have a whole section on what if you and your partner don't live together? What if you're not in the same household? Then what? And again, we're trying to be very practical and offer people some advice and tips depending on their situation. We'll go to the next slide. This is another area, you know, in terms of risk. And I think, again, some of the early advice was, you know, your next safest partner is someone that you live with at home. But we felt that we need to take that a step further. In a sense, we're afraid that that will give people a false sense of security. Just because you live with someone at home doesn't mean that they're not at risk or that they might not have the virus. And so the way that we'd like to frame this is to really get people to start thinking about the questions that they can ask each other. So for example, are you following CDC guidelines regularly? Are you social distancing? Are you hand washing? Are you wearing a mask in public? Have either of you had possible exposure to the virus through working, transit, other people at home, frequent trips to the store? And then have either of you had COVID-19 or symptoms? And then I think the other really important question to think about is, do either of you have health conditions like high blood pressure or diabetes that could put you or your partner at higher risk of complications? And then I think, you know, the advice is you need to have these conversations, talk with your partners, and then really decide together what risks you're willing to take when it comes to close contact or sexual contact with a partner. Okay, so moving on to the next one. And I think, you know, we're in an interesting place right now. And the way I think about this is that, you know, for many people might say they're spending too much time together under the same roof 24/7. And for others, they're spending way too much time apart. And so this is can be a very challenging time for relationships and can put stress and strain on relationships regardless of the situation we end up in. So in our messaging, we've aimed to offer up some practical tips of things that people can do to maybe help relieve some of that stress and strain. So things like, you know, carving out time for yourself, right? Giving yourself some downtime, finding some things that you'd like to do that you enjoy on your own. Also thinking about planning quality time together. I mean, it might not feel like a lot of us are having quality time together right now. There's a lot going on in many households. So really thinking through what can we do that will be fun, that'll be enjoyable. And then I think recognizing that this is a stressful time, you know, for pretty much everyone. So to the extent that we can try to be patient and try to be kind, it's going to help all of us in our relationships. And then another point is really thinking about, you know, how we argue or how we disagree. You know, can we do that in a constructive way? Can we try to avoid name calling and blaming? And then there's another really key point that did not get on this slide here, but I think the other issue is talking openly about your sex life together. You know, there's been a lot of coverage in the media. Some people are saying, oh my gosh, COVID-19 is the best thing that ever happened for my sex life. And other people are saying, wow, you know, I should feel that way, but I don't. And my sex life is actually not what I want it to be. So I think recognizing that, encouraging open dialogue about that is also really important. So, you know, those are just some of the core tips that we've offered up, but we do link to our 5 action steps because we have a lot more very specific content around building and maintaining healthy relationships. So we can move on to the next point. As Jen mentioned, one of the other issues that we think is really important is helping people navigate health services right now. And basically we want to make the point that your sexual health is still a priority. And so we address things like how can you access STI testing and treatment? How can you access birth control? How can you access other sexual health services that are important? And so we talk about, you know, the fact that this care might be delivered differently. You might be getting no touch care through telehealth. And in some cases, you still will have in-person visits. We also emphasize that you shouldn't ignore symptoms. You know, if you have symptoms that you think are related to an STI, it's important to seek care right away and take care of that. The other topic that we think is really important and we'll be developing in more detail is keeping up with care and treatment for HIV. And this will also explore issues around PrEP and PEP and other topics around HIV. And I think lastly, you know, what's a little challenging at the national level is that, you know, services are being delivered in different ways in different communities by different providers. So the best advice we think we can give is to encourage people to talk with their provider, contact their clinics, contact their health departments, and find out what their options are locally, because this will really vary widely across the country. Okay, next slide. So as Jen alluded to, I mean, I think this is, you know, there are so many challenges of dealing with COVID-19. And one of the really serious ones is how you can address and cope with an abusive relationship while you're on stay-at-home orders. You know, we know this is much more challenging and much riskier. So we did look at some of the leading organizations and tried to summarize some of the practical tips for making and implementing a plan if you have to stay at home in an abusive situation. We've also included some messaging here for the LGBTQ community, acknowledging that many people might not feel comfortable staying at home in their particular family with their particular situation, and that's also extremely important. So this section also talks about how can you seek help safely and confidentially. I think communications can also be challenging when you're at home and you might not have privacy. So we direct people to online chats and other mechanisms that will allow them to communicate more privately in these situations. So that is a very quick overview of the types of messaging we've developed, the topics that we've tackled. And I really encourage you, hopefully, you'll be able to go to the website and look at this in more detail. We've produced a fact sheet that covers all the topics, which is quite lengthy, but then we've also carved these topics into 3 different smaller and shorter fact sheets. So you can access those. These are in the public domain. Feel free to use them, print them, share them with anyone. They are out there. And as Jen mentioned, we will be updating these. They are a living document, and we'll be adding new content. We'll be updating it with new data, new recommendations as they become available. The other thing I wanted to mention, if you go to our website, you can also find a quarterly social media campaign that we developed. And we develop these campaigns for our members, but they're also available to anybody through our website. And this campaign focuses specifically on COVID-19 and sexual health. And they link to these fact sheets, they link to media stories, other organizations. So those are also in the public domain. You can use that content and promote it however you'd like to do so. So I think that is, I will stop there, and we would be happy to take any questions. Also, as Jen said at the beginning, if there are particular topics or message areas that you think would be helpful for us to address as a coalition, we'd love to hear about that as well.
Susan and Jen, thank you very much. We're going to encourage people to come off mute and ask their questions. If you would rather not and would want to put your question through the chat box, that's also okay. But I'm going to ask the first question, if I may, because there's a couple of people who asked this through the chat box, and they want to know if you'll be able to make your PowerPoint slides available.
Yes, I think that's totally fine. Jen, does that work for you?
Yeah, I absolutely. I'm not quite sure how we can share this with you. They're not actually on our website right now. The main messages are, but Bill, if there's any way that we can share those with you and we can get them out, we're absolutely happy to do that.
Okay, whatever works better for you. If you want to put it on your website, if you want me to distribute it by email, if you want the email list, whatever, we can work that out afterward.
Great.
And folks, the website is nationalcoalitionforsexualhealth.org. And I put that in the chat box as well. So what questions do we have? Be sure to hit that little microphone button in the lower left section of your screen and come off mute.
Hi, my name is Laura Croft, and I work in Des Moines, Iowa as the Pregnancy Prevention Program Coordinator for adolescents within the state. And we're, again, looking at adolescent youth in this time of trying to message and educate around pregnancy prevention and everything to do with sexual health. What do you have? What tools have you had or used specifically for reaching adolescents or maybe even the special education population that we serve?
So Laura, are you talking specifically about COVID-19 and sexual health?
Yes, trying to figure out how we can get that messaging out right now to them. There's a variety of ways that we're continuing to do our own curriculum across the state, but we haven't really branched out into the COVID aspect, and I think that's a need that we have to do, but we don't really have the tools yet on how to do that the best way.
I think, you know, it's a really great point, and this actually came up in an earlier call as well, which I think, you know, from a coalition standpoint, you know, our guidance is fairly global, right? And as a national coalition, we try to develop content that's relevant and appealing to a wide range of Americans across the, you know, the age spectrum. We did have someone on the last call bring this up as well and talked about, you know, thinking through, you know, with youth and thinking about risk, you know, some risk-taking behaviors and other things that might be specific to youth. Also about, you know, guidance around how they're communicating and interacting with people can be different. So I think this is a really excellent point. And I know that Jen and I will talk more about this moving forward. And I think just trying to think through what are some of those special dimensions for youth that we really need to make sure that we're addressing. So, you know, any specific topic areas that you all think would be really helpful, we would love to hear about, because I think that's something, I mean, you know, there's a lot of guidance out there now around virtual dating, right? But then with virtual dating, there comes risk as well. So, I mean, I think that there are lots of potential topics.
Right, and we also know even about sexting and all that, right? Like wonderful, and yet we have to be really cautious. So what are those specific messages, especially because youth, they, you know, they're gonna get, we were just saying, we are getting sort of lockdown fatigue and starting to rule bend. So what does that mean in terms of even harm reduction, and how do we speak, instead of it being fear-based or just blind to the realities of what youth might be going through, that we're making sure that we're creating messages that really resonate and aren't, really resonate.
Sandra Williams has a question.
Hi, yes. I teach middle school, and it's a little bit hard to try to talk to them right now about anything more than just the first few weeks I did the COVID and what the precautions are and etc. I still do phys ed with them. We work out every day.
Oh, good.
Yes, I do. I'm sore right now because I do my personal workout in the morning and then I have to do 2 more workout with them every day. So that's 3 workout a day. I'm tired right now.
Yeah.
I'm actually putting in grades right now, but I don't know how. I was still trying to follow the scope and sequence for middle schoolers. For the first couple of weeks, I did the COVID and everything about it as much as we knew. I just wanted to know, I just hear you mention to Laura about, I guess, a variety or a wide curriculum. I just wanted to know if you would have anything age appropriate for middle schoolers as opposed to a wide range of everything. And that way I can, or I have to read the entire thing and then take out what I think is appropriate. That I definitely didn't want to do. I just wanted like age appropriate for middle school versus high school, things that I can give them. And not only that, the resource, but even like an example of a lesson, that would be great.
That's great. Look, Sandra, I can't promise you that's something that's on our plate. I think we are definitely committed to making sure that we create messages that are particular for youth. But what I can say is that there's a lot of good organizations. I'll just say one right now, and I'm sure there's others that people could chat in, like Advocates for Youth, that may be creating specific messages for youth, including curricula. And one of the things that we've been doing is also compiling resources, really good resources. And again, if that can be useful to you, we would love to be able to provide that. We don't usually provide curricula per se, but I think still some of those messages are really important to get out and continue to get out, and clear and concise and accurate ones.
Correct. That's what I need. Perfect. That's no problem. Thank you so much.
If I may mention one resource that I'm familiar with, Mary Jo Projerski recently published, she writes a series of books titled Nonny Talks About, and it's Nonny Talks about sex, about pregnancy, about puberty, about gender, about all the different topics. And she recently published Nonny Talks About Quarantine for grades 3 through 8. And I think very generously made it available for free online. Now, where it is online, I don't know. It's Nonny, Nonnie, Talks About Quarantine. Oh, look, someone posted the link in the chat. Wow, fantastic.
Awesome.
People are fast.
You.
Wow, thank you, Bridget.
Thank you, Bridget. Yes, thank you, God. Sorry.
As we all know, you guys are the experts on this call. You probably know just as much. So
yeah,
that in any interest you might have.
We have just a few more minutes. Just out of respect for everybody's time, and we're actually over time. But if people have any more questions, maybe we take 1 or 2 more questions. And of course, if you need to leave, nobody is going to be offended if you need to go. But do we have other questions?
I have a question. My name is Sarah Colvario, and I work for the Massachusetts Department of Public Health. I work with a much older population, meaning adults, like all of us. And what I want to know is, I try to collect really accurate information to provide patients that we talk with, really accurate information about their sexual health risk. But what's challenging is when we're hearing things that they've done that put them at risk for COVID. For example, in our state, there's a limitation of no groups of 10 or more. And so someone very excitedly told their clinician, oh yeah, I had a group sex party. There was only 9 of us. And so what I'm wondering is how to still be non-judgmental, obviously, but also just kind of, if you have any suggestions about how to best be non-judgmental, but then also be able to inform individuals about their risk, not only for STIs in a circumstance like that, but also COVID. And also acknowledging too that, yeah, it's great that you were with 9 people when usually these parties are 50 plus. Like, that's awesome you took that step. And like, here's another thing to consider.
So Sarah, I was going to mention, I don't know if you've seen this yet, but there was an article that came out. Jen, is it the Annals of Internal Medicine that it came out in last week? Have you, Sarah? And it was a framework to help providers talk with their patients about this in a very realistic,
Well, that's great. Thank
non-judgmental
you.
way. I don't know if we can find the link for that, but that might be a good place to start.
It's online and it's free right now, and they acknowledge the fact that that any contact right now can be risky, and yet acknowledging the fact that like we cannot go back to abstinence only education where we saying you just have to stay away. Like that's not the way forward. That fear-based, shame-based way, and they provide some practical suggestions, including a table that sort of talks about different risk levels and what you can say. And if you drop your email, we can even forward that to you if that's helpful. You may also be able to find that online.
Cassandra Perry in the chat box noted a YouTube video on polyamory and COVID-19. So check that out, save that link. Any other questions?
This is
Okay.
Beverly. I just want to thank you, Bill and Jenny and Susan, for doing this. It was wonderful. Thank you so much.
Thank you, Beverly. And I have to say, Beverly has been with the coalition since our very, very beginning days and has played a big role in shaping it. So Beverly, we appreciate your support, and it's great to see you on tonight.
Thank you, Beverly. And a note from Debbie Rothman, author of Talk to Me First, in the chat box, reminding us to check out the amaze.org videos, which are fantastic.
Yeah,
Thank you for that, Debbie.
Yeah, they're great. Thank you.
All right, well, I want to thank our speakers, Jen and Susan. Thank you very much. And thank you, everybody, for spending time with us this evening. We're going to continue the series Wednesday evenings. This was kind of like a special exception to add something on Thursday. Next Wednesday, we're going to have Delmasio Flores and Sarah Aboud discussing their publication, Hegemonic Masculinity During Parent-Child Communication with Sexual Minority Male Adolescents. If you're not already signed up for that and you'd like to be signed up, please visit the journal lecture series, or I'll probably follow up with an email just reminding you of that link. Thank you all, and be well, and take care.
Thank you, guys. Appreciate it.
Thank you.
Bye, everyone.
Bye-bye.
Thank you.
God bless.
Bye.
Bye-bye.
Jen, Susan, thank you again. Fantastic.
Thanks, Bill.
Thanks, Bill.
Thanks, Bill.